for those that couldn't make it today. But we'll just start with, I really like seeing all the introductions coming through in the chat, so keep on putting those there. But we wanted to start kind of from the project side, the Penn State side of the project, just kind of making sure people were aware of the different names that you've seen float around related to this project. So there's myself and Lewis, which are the project leads, and yeah, we are coordinating this project with Lewis and us. He has a couple people in Texas. So you might have seen emails, or I know you've received emails from Yvonne or Mary. Mary is her first name. She goes by Yvonne Gaddy, and Dan Schmidt around those incentives. And, you know, Sophia and Phyllis provide a lot of support. Megan, Melissa, and Jeff, you know, they'll be our main contacts, TA provider contacts on the project. And then other people involved related to data collection specifically are Diana Crom and Mindy, and then there's some interviewers as well. But those are probably the people the names you've seen float around the most. And right now I'm seeing the PowerPoint.
Yeah, I'm not sure what happened there.
Okay. Okay, great.
Yep, this is the page we want.
Okay,
sorry about that.
Yep, nope, no problem. So we'll just move in a little bit to the logic model, kind of thinking about the why of the project. I think we'll also kind of review timeline a little bit. We'll also talk about, well, what does it really mean to be in that coalition, in the Streamlined Coalition Check-Up group? So hopefully you'll have a much better understanding of those things when you leave today. And so first, yes, we wanted to talk a little bit about the why. And, you know, in some ways, kind of leading up to today and talking about the project and through that recruitment period, we were really talking a lot about the nuts and bolts of the project, what coalitions would actually be doing and what would our roles be. And we talked so much of that, about that, because certainly you needed to know those things to make a difference, or to make your decision and to know what kind of you were getting into. But then at the same time, we've kind of forgotten to talk about the why, you know, why this is important. And so that's where we wanted to start today. You know, and so I think we'll kind of do an overview here. Certainly feel free to ask questions and we can dive into it more. But, you know, what we have learned over time about how coalitions work, you know, to improve health and development for youth and families. You know, we have learned that the resources, you know, so that first line there, that the resources that a coalition has access to or brings to the coalition or develops within their coalition. So those resources can affect how the coalition operates. And so that's that middle one, the coalition functioning. And then how that coalition functions, so kind of the coalition processes and those coalitions, you know, how the coalition is structured. The internal workings of a coalition, that can affect then the quality of their community improvement activities. So those activities, those programs, those efforts, you know, kind of the footprint that the coalition has in the community, how it reaches youth and families. And so, so then, of course, the quality of those community improvement activities or those programs activities, the quality of those activities then has a direct impact on the outcomes of the project, has a direct impact on youth health and development of families. And so we know that from both the research and our experience that technical assistance is important, right? It can be quite helpful when managing a process as complex as this. I mean, this is a very complicated process, although I don't need to tell you that because you live it every day. But we don't really know what is it about technical assistance that matters. We also know that technical assistance is often not as readily available for coalitions once they get past that startup phase, right? And so that's why NIDA, you know, National Institutes of Drug Abuse, That's why they were interested in funding this. They recognize the importance of community coalitions in this work, in this area of supporting healthy youth development and healthy families. And they want to know, how can we do this better? How can we support that work? And so the way to find answers to that was to go ahead and let's bring in some resources. Let's bring in resources to support this intervention, this project, these activities, and a little bit of research to go with the project so we can have more clarity and better support community efforts in substance abuse prevention and healthy youth development down the line. And so with that, we recruited 58 community coalitions in Pennsylvania. And after randomly dividing those 58 into those two groups, so every coalition had an equal chance of being in that full coalition checkup group or that streamlined coalition checkup group. You guys, the people here and a bunch of others as well that couldn't make it today, and we'll send the link to, ended up in the streamlined coalition checkup group, which really is a great place to be. And so, we'll talk more about what that really means today. But quite simply and frankly, like, we couldn't do this project without you, and you have a very important role here. So I think I'm going to stop there. I think we're going to move into, Jeff is going to talk a little bit about more like what that really means. And yeah, go ahead, Jeff.
So if you're here today, you're probably wondering, what does it mean for me in terms of technical assistance that's available to me as part of the Streamlined part of the research project? And what we want you to know is that it means that all technical assistance opportunities that you previously used or were eligible for are still available to you. So I know Megan's going to go over resources here in just a few minutes, but some examples of that. If you normally work with us for helping you with your PAYS data, or talking to folks in your community about PAYS data, if you work with us for help with communities that care training, or social development strategy training, or you work with program implementation specialists on a specific evidence-based program from EPIS, or anything else at EPIS that you normally reach out to us for, nothing changes for you in terms of what was available to you previously. You still have access to all of those. Or if you're learning about some of these resources that are available that I just mentioned, or that Megan's going to go over that you haven't previously taken advantage of, those are there for you as well. And in addition to those, you have access to a couple of new things. The feedback summary report that Sarah mentioned, it's getting close. We're really all excited to see those in finalized forms. Those will be coming to you with a lot of great information. And in addition to that, you'll get action planning materials. So the main takeaways for today, as a coalition leader in the Streamlined CCU, everything that was available before the checkup project is available to you today, and you get a couple of neat things in addition to that going forward.
Great, thanks, Jeff. And so the timeline moving forward then from this point, we're still filing some of those details on those feedback summaries. We're hoping, maybe late January yet, but we're getting close to late January. So it'll probably be that first week in February or early February that you'll have that feedback summary in your inbox. As you'll see in a couple minutes, we are building that summary so it works really well on a computer to kind of view and navigate on your computer, an electronic copy. But if you would like a printed copy of that report, we are happy to go ahead and make that copy and send it to you. Just let us know. Let's see. So that's coming up first here, is sharing those reports. In April then, or around April, we'll be sending those action planning materials. And then looking more for September, October, again in the fall, we'll be moving towards the surveys again. And so we'll start the process over. And so that's kind of the big time, buckets of time, or kind of bookmarks in time, I guess, coming up for the rest of the year. Are there any questions or anything related to the timeline? Okey-doke. So yeah. So then why don't we go ahead and At this point, then let's go ahead and move in, and actually you'll get a kind of a preview of what these coalition feedback summaries look like. Remember, really, this feedback summary is yours. It is your data, and you are free to use this however you see fit. And so, Melissa, if you want to go ahead and do a little navigation here, or kind of demonstration, I guess.
Sure. And I did see we just had a question pop up in the chat. So Susan, we will get to that and address your question there, but let me just get through this first. And yeah, definitely any other questions you have, go ahead and either speak up or just put them in the chat. We really do want this to be interactive and a way that you can get all of your questions answered today. So as far as the coalition checkup feedback summary goes, is everyone able to see this PDF on my screen right now? Okay, great. So this is basically what it's going to look like. Of course, it will be personalized. We've talked about that quite a bit, that this is an individualized, personalized summary for your coalition. And like Sarah had mentioned, we can provide you with a print copy of this if you'd like, but it really is optimized to use on your computer. And you'll see why as we go through this a little bit. So there are just a couple things that I want to point out here. The first real page here is our table of contents. And when you look at this, I want you to think about this as being sectioned off into 3 chunks. So we have resources, coalition functioning, and community improvement activities. And those are those 3 areas that Sarah mentioned in the logic model. So those terms should sound familiar from just 2 minutes ago. So when we look at each of these sections, you can see that they are summarized in dashboards. The resources section has 1 dashboard, the resources dashboard. The coalition functioning section has the coalition process dashboard and the coalition structure dashboard. And then the community improvement activities has the program implementation dashboard and the change activities dashboard. You can see below each of these dashboards, there are a list of categories that correspond with those dashboards. And then you'll see in a minute that within each of those categories, we can break it down even further into different characteristics based on the information we gathered from those surveys pertaining to each of those topics. I'm going to skip ahead to page 5, and this does give you a good guide for how to navigate the report and how to interpret the report. You can see that it is going to be using a color coding key. This teal color is areas of strength. The lighter color is a neutral or average metric. And then this orange or coral color are potential areas for growth. This page also describes a little bit of navigating through the report. So we have arrows, a cog, this kind of swirly arrow, and then you can see on each dashboard, it shows you exactly where they are. I'm going to take you to some of those pages right now, just so you can really see how this report works well on using the computer, the electronic version. So like I mentioned, this is one of the dashboards, and you can see the different categories here are color coded. This is actually just kind of a sample. So this data doesn't really belong to anyone. It was just kind of the colors were plugged in just so we would have something to look at. But from each of the dashboards, you can use these arrows to either go back to the table of contents, and then from there, use these hyperlinks to go to a certain page or a certain topic. So we can go back to the resources dashboard. These arrows down here will take you to each of the different dashboards. So you can just, scroll right through each of those dashboards. And then of course, go back to the I can't go back to the table of contents because my screen sharing image is there. But normally you would have no problem doing that. So let me just show you one more of the hyperlink features for this. When you are digging down into the different categories, there's this cog up here, and that takes you right back to your resource dashboard. That was a lot of information right there and a lot of navigation. One thing that I really want to assure you of is that this is a PDF file that that you can click around, you can scroll, you can, you know, really do anything to this document on your computer, and you can't mess it up. So when you get this, you know, feel free to just start clicking around and getting really familiar with how to navigate and how to read through this report. Like I said, it's PDF, so you know you don't have to be worried about messing up your data in any way. So I'm going to stop sharing and just see if there are any other questions. And I'm also going to make sure that we get Susan's question answered as well. So go ahead and type in anything else, and we'll go ahead and address Susan's question. She asked, will you tell us what we are not getting? So Jeff really talked about a lot of the things that are still available to the Streamlined group. The main difference for this group is you'll have access to all of these coalition checkup materials. You'll have access to the Epicenter technical assistance providers, but we won't be walking you through a prescribed timeline of working with these materials. So if you've been through like the communities that care process, you kind of remember how there were the different phases. Sorry, my dog. I think my son just came home and now my dog's trying to protect me from him. So you remember from that process that as you went through the different phases with your TA provider, they were always trying to keep you on track. This is what you have to do next, and feeding you those materials. And I don't want to say holding your hand because we're all adults and professionals, but really guiding you through that process. And so that really is the one thing that separates the full coalition checkup group from the Streamlined group, is that you're not following the prescribed process. And hopefully I explained that right, Sarah. Please add anything to that, and we'll give people a chance to ask any other questions that they have as well.
Yeah, I think you described that pretty well. So.
All right, we will move on with Megan. I'm going to go ahead and share my screen again.
All right, thanks, Melissa. So looking at, who we have on the call now, I know a lot of you are familiar with the resources that are available through Epicenter. A lot of you are using them already. Please continue to use them. That's what we're here for. This is just as an example, I'm on this project 25% of my time. The other 75%, I'm still working, and so is Jeff, on all of these other things that Epicenter offers. So just to give you a really brief rundown of what we do, EPIS is a project ad with the Prevention Research Center at Penn State. We are, this part of EPIS is completely funded through Pennsylvania Commission on Crime and Delinquency. Doesn't matter if you have a grant from them or if you don't have a grant from them. If you reach out to us for any sort of technical assistance, we are happy to help with no cost to you. So please know that we're here. Email myself or Jeff or anybody, and we'll point you in the right direction. Just a couple of examples of what we have been working through. Every month we have learning community calls. That topic is based upon what other coalitions are really looking for. We just held a Pennsylvania Youth Survey learning community call because we had a new mobilizer, or kind of an overview Communities That Care training in December. And one of the topic areas that folks wanted to talk about a little bit further was the Pennsylvania Youth Survey. So we're able to turn that into learning calls. You will see emails. We work really closely at the bottom with CPA, the Commonwealth Prevention Alliance, twice a year for most regions, 4 times a year for that Philadelphia area region. You will have a regional meeting of coalition leaders, of drug and alcohol preventionists, really a group of like-minded people in your area that you can share resources from. Part of it's networking, part of it is, we usually have a relevant speaker at the time. I did talk about those mobilizer trainings, or those coalition just overview trainings that we provide. Again, it's not prescribed that we must do it, or we every month, or we can't do it every month, or it really depends on what you all are looking for and what you're interested in. We also help coalitions, as I believe Melissa said, go through that prescribed coalition specific training and support. So using that Communities That Care model and going through those. We also partner with Pennsylvania Liquor Control Board, looking at their grants and materials. They have a lot of mini grants out there now. We work with Pennsylvania Commission on Crime and Delinquency, also Pennsylvania Department of Ed, just on different grants, different data, different trainings. It's really our job to make sure that really everyone working in prevention, whether it be evidence-based programs, coalitions, are getting the most up-to-date resources that they can, and that they know that they have some support through us at EPIS. So again, I can't say it enough, but please reach out, and we'll, whether it's for an evidence-based program, coalition work, we also have work for juvenile justice programming, for Department of Drug and Alcohol Needs Assessment. Please reach out, and we'll point you in the right direction.
Thanks, Megan. And as you
my email and chat.
Yeah, I also wanted to mention that we've been talking a lot about how if you already receive technical assistance from EPIS, that won't change. But we should also mention